Welcome to the Medical Conditions and Procedures channel. This channel's goal is to educate, enlighten, and assist people to make informed decisions about their health. In this video, I explain the common cold. The common cold is highly contagious and is typically spread through respiratory droplets when an infected person coughs, sneezes, or talks. It can also spread by touching surfaces or objects that have cold virus particles on them and then touching the nose, mouth, or eyes. The common cold usually lasts for about 7 to 10 days, although some symptoms might persist for a bit longer. It's generally a self-limiting condition, meaning that it resolves on its own without specific medical treatment. Rest, staying hydrated, and over-the-counter medications for symptom relief, like decongestants, antihistamines, or pain relievers, can help manage the discomfort associated with a cold. It's important to note that the common cold is different from other respiratory infections like the flu or pneumonia, which can have more severe symptoms and potential complications. While a cold might be bothersome, it usually doesn't lead to serious health issues in otherwise healthy individuals. The common cold is caused by viruses, and there is no cure for it. However, the symptoms can be managed to help you feel more comfortable while your body fights off the infection. Here are some steps you can take to treat the common cold. Get plenty of rest to allow your body to recover and focus its energy on fighting the virus. Drink fluids like water, herbal tea, and clear broths to stay hydrated. Warm liquids can soothe a sore throat and help relieve congestion. Saline nasal drops or sprays can help alleviate nasal congestion by moisturizing the nasal passages and thinning mucus. Inhaling steam from a bowl of hot water or taking a warm shower can help relieve congestion and ease breathing. Using a humidifier in your room can add moisture to the air, which can be helpful for soothing irritated nasal passages and reducing congestion. Non-prescription medicines can help alleviate specific symptoms. Decongestants can temporarily relieve nasal congestion. Antihistamines can help relieve sneezing, runny nose, and itchy eyes. Pain relievers such as Tylenol or ibuprofen can help reduce fever, headache, and body aches. Follow the dosing instructions carefully. Cough drops or lozenges can provide relief for a sore throat and reduce coughing. Taking a combination of lemon, honey and ginger have been known to be effective against the common cold. Avoid smoke, strong odors, and other irritants that can worsen your symptoms. Wash your hands frequently to prevent spreading the virus to others and avoid touching your face, especially your eyes, nose, and mouth. Gargling with warm salt water can soothe a sore throat and reduce inflammation. It's important to note that antibiotics are not effective against the common cold because antibiotics target bacteria, not viruses. Also, excessive use of antibiotics can contribute to antibiotic resistance. If your symptoms are severe, you have a high fever and/or difficulty breathing, or your symptoms don't improve after a week or so, it's a good idea to consult a healthcare professional. Additionally, if you have underlying health conditions, are pregnant, or have concerns about your symptoms, seek medical advice for proper guidance. Thanks for watching. If you would like a medical condition or procedure explained, post in the comments below. Don't forget to hit the subscribe button and turn on the notification bell, so you never miss any of our upcoming videos.